This lecture covers the third part of the skeletal system, pathology of bones. Arthritis is a general term used to describe an inflammatory condition of joints. Osteoarthritis is a degenerative joint condition from normal wear and tear of a joint. On this x-ray, you can see a normal knee on the right-hand side and a knee affected with osteoarthritis on the left. If you look at the joint space in the normal knee, you can tell that it's pretty uniform throughout. Also, if you follow the line of the bones within the joint, they're pretty smooth and flat. However, if you look at the knee with osteoarthritis, you can tell that there's almost complete loss of the joint space on the lateral portion of the joint, where the red arrow is pointing. And if you follow the lines of the joint space, there's a lot of bone spurring, and it's not quite as smooth as the normal knee. Rheumatoid arthritis is an autoimmune disease affecting connective tissue. It typically involves the small joints of the hands and feet, but can involve essentially any joint in the body. And here you see a picture of a woman who is affected by rheumatoid arthritis, and you can tell that it is most prominent in the small joints of the hand, specifically the knuckles. Septic arthritis occurs when an infective pathogen is introduced into a joint. Here you can see that it is very hot, red, it's very tender, and it causes an extreme amount of pain anytime you manipulate the joint. The infective pathogen can be introduced into the joint by spreading through the bloodstream or by introducing an instrument such as a needle into the joint that is infected. Gout occurs when uric acid crystals precipitate into the joint space. The most common joint that is affected by gout is the base of the big toe. Here you can see a picture of gout crystals under the microscope. And you can tell that gout looks very similar to septic arthritis. They're both very hot, red, and tender. The most reliable way to differentiate between the two conditions is to take a needle and drain some of the fluid within the joint and look at it under a microscope and see if you see bacteria and white cells like in septic arthritis, or if you see uric acid crystals like you do in gout. Tendinitis is a painful inflammation of the tendon. It's usually caused by overuse, but can be from many different things. And we treat tendinitis by what we call RICE, which stands for rest, ice, compression, and elevation. Sometimes we can treat tendinitis with steroid injections. Bursitis is a painful inflammation of a bursa. This can be septic or it can be from overuse. Here you see a picture of olecranon bursitis. So there's a bursa or a fluid-filled sac that covers the tip of the elbow to protect it. Olecranon bursitis is usually caused by repetitively resting the elbow on a hard surface such as a desk or an armrest, although it can be septic. The treatment is same as tendinitis, assuming that it is just inflammatory and not infectious. Rotator cuff tears occur when one of the tendons of the muscles responsible for moving the shoulder is torn. Here you can see one of the tendons is disrupted. Surgery is usually their treatment for this issue, followed by 3 to 4 weeks of immobilization and then intensive physical therapy thereafter. A sprain is an injury to the ligaments of a joint, so the connective tissue that joins two different bones. It can range from a strain without tendon damage at all to a complete tear of the ligament. Treatment depends on severity. This is typically what a pretty significant ankle sprain looks like. There can be bruising and a lot of swelling involved. If the sprain is severe, the patient may require surgery. A joint dislocation occurs when the distal portion of a joint is no longer in the correct place. We treat this with what's called closed reduction, which means we don't do any surgery on the joint. We simply manipulate the affected bone and get the joint back into place. So you can tell that this gentleman's right shoulder is dislocated. So now let's cover some abnormalities of the spinal column. Vertebrae are separated by pads of cartilage called the intervertebral discs. So these are like the blue areas in this diagram. A herniated disc occurs when the soft interior of the disc erupts through the fibrous covering around the disc. The herniated disc may then push on the root of a nerve, causing pain which radiates. So this would be shooting electricity-like pain down the leg, down the arm. Sciatica is an example of a herniated disc pushing on a nerve root. Kyphosis is the abnormal posterior curvature of the upper spine. This is commonly referred to as a hunchback, as you can see by this tennis star here. Lordosis is the abnormal anterior curvature of the lower spine. Scoliosis is the abnormal lateral, meaning right or left curvature of the spine, and this can occur anywhere in the spinal column, but you can tell that this gentleman here has pretty significant scoliosis as his spine is S-shaped. So now let's talk about bone fractures and healing. A fracture refers to any break in a bone. A closed fracture has skin over the fracture that is still intact. So this young man has broken his wrist, but the skin overlying the fracture is intact. An open fracture is classified by bone that has protruded or punctured through the skin. And this needs to be treated with antibiotics to prevent infection in the bone. A fracture in which the bone protrudes through the skin is also known as a compound fracture. It's not always this dramatic. Sometimes you just see a hole in the skin if the bone has poked through and then gone back into the limb. So you have to be really careful when you're inspecting these because any break in the skin is considered an open fracture. We classify fractures in many different ways. A transverse fracture is a fracture which occurs at a 90-degree angle to the long axis of the bone. A linear fracture is parallel to the long axis, and an oblique fracture is at any angle other than 90 degrees. An oblique displaced fracture is just a fracture at any angle other than 90 degrees, and the two fragments of the bone are no longer touching. A spiral fracture spirals around the shaft of the bone, and this can be caused mostly by twisting motions on the bone. A green stick fracture affects only one cortex, so meaning that the fracture doesn't go entirely through the bone. This is very common in children as their bones are a lot more pliable and therefore they can tear instead of break. A comminuted fracture is a fracture in which the bone is in multiple fragments. If the bone fragments of a fracture are not touching anymore, they must be reduced or put back into place to facilitate healing. Closed reduction involves pulling on or manipulating the distal fragments to realign them. Open reduction involves surgical realignment of the bone fragments and often requires the placement of hardware in order to keep the fragments in place. So you can see the original fracture in panel A. It's pretty comminuted, lots of different pieces, and this patient underwent closed reduction and internal fixation. So they had to, open reduction and internal fixation. They had to surgically open the area and place hardware in order to keep the bone pieces in the right place. So when we talk about bone healing, the first step, bones are very vascularized. There's a lot of blood vessels within a bone. So when you break a bone, it bleeds pretty heavily. And that bleeding forms a blood clot around the bone that is called a hematoma. Then a soft callus of fibrous tissue forms around this area, and this sort of lays down scaffolding for the bone healing to take place. This fibrous callus is then calcified, causing a bony callus of the bone. And then over time, the osteoblasts and osteoclasts remodel the bone to make it go back to its original shape.